What is leukemia? The definition of leukemia is white blood cells. The term leukemia was first used to describe a change in the ratio of red to white blood cells which are produced in the bone marrow. Leukemia is the most common cancer in children and adolescents. An individual suffering from leukemia has more white blood cells than a healthy individual. Although white blood cells function to fight infections, these abnormal cells, therefore, do not fight infections. These abnormal cells are called blasts because they are immature and never reach a point of maturation. Overproduction of the abnormal cells causes overcrowding in the bone marrow. Red bone marrow is the soft, spongy center of certain bones. In the bone marrow of any flat and thin bones, the three major blood cells are produced: red blood cells, white blood cells, and platelets.
In a healthy body, the three formed elements of blood are erythrocytes, platelets, and leukocytes. Erythrocytes, also known as red blood cells, are responsible for carrying oxygen to different organs. Platelets are used to prevent bleeding. The function of leukocytes is to fight infections. Leukemia affects two types of leukocyte stem cells, the myeloid stem cell and the lymphoid stem cell. There are four types of leukemia. They are classified by whether they are acute or chronic, and according to the predominant cell type, lymphoid or myeloid. Chronic means a slow-developed process over a long time period that has frequent reoccurrences. It is involved with proliferation of the later cell stages. Acute means a quick reappearing, rapid onset with a severe course and a short survival rate. Acute derives from stem cells and primarily affects children. Lymphoid leukemia involves immature lymphocytes and the transformation of B and T cells. Myeloid involves myeloid stem cells in the bone marrow and interferes with the maturation of red blood cells. Stem cells are undifferentiated cells that can specialize. They are formed in the red bone marrow and produce lymphoid stem cells. Lymphoid stem cells are produced by the hemocytoblast and are necessary for defending the body. These cells then form lymphoid blasts, which mature into B and T lymphocyte cells. Some B cells protect the body by producing plasma cells that secrete antibodies into the blood. T cells manage the immune system, and some directly attack infections. T cells migrate from the red bone marrow to mature in the thymus, while B cells mature in the red bone marrow. In lymphatic leukemia, B cells are most commonly affected. As a result, viruses and bacteria are not destroyed.
Symptoms of lymphatic leukemia are nonspecific but can include the following: weight loss, fever, night sweats, fatigue, loss of appetite because of pain from collecting leukemia cells in the kidneys, liver, and spleen, bleeding and bruising because platelets are not being produced, bone pain, result of overcrowding in the bone marrow. Lymphadenopathy occurs when the leukemia cells collect in the nose, causing swelling, headaches, bone abnormalities, and anemia, which occurs because red blood cells are not being produced. People who have some of the following have an increased risk of getting leukemia: HIV, hepatitis C, smoking, certain exposure to chemicals, radiation exposure, infections, are Caucasians, are between the ages of 2 and 5, are male, if they have a sibling with leukemia, and certain genetic disorders such as Down syndrome, neurofibromatosis, Bloom syndrome, ataxia T, but the exact causes of leukemia are still unknown.
Homeostasis is the maintenance of constant conditions in the extracellular fluids. Leukemia, although it primarily affects the production of leukocytes, influences red blood cells and platelets. For example, it affects the red blood cells because when anemia is present, the blood oxygen carrying capacity is low, affecting metabolism and the internal environment. Furthermore, leukemia also affects the platelets because the disruption of blood coagulation resulting in more bleeding. Lastly, it affects the white blood cells because the healthy cells have limited space to grow, making the body more prone to recurring infections. Proteins are created by the information provided from DNA. When the DNA is altered, so are the proteins. Ordinarily, proteins are important because they produce signals, regulate and control normal cell growth, and differentiation. Translocations are structural changes of the chromosomes. Therefore, one part of a chromosome becomes located on another chromosome. A translocation that may result in leukemia is when chromosome 9 ABL gene and chromosome 22 BCR gene form the Philadelphia chromosome. This protein causes cells to proliferate and causes malignancy.
In summary, leukemia is the cancer of the blood. Lymphatic leukemia affects the red bone marrow, causing overcrowding and decrease of healthy white blood cells. Therefore, the body cannot fight infections.